Good day, viewers. I'm Ukore Goodness Amarachi. I want us to discuss high blood pressure as our topics for today's program. Please don't forget to like and share our videos. First of all, I want us to understand what high blood pressure is all about. We all know that high blood pressure is one of the common illnesses. High blood pressure is a common condition that affects the body's arteries, which is the blood vessels. It is also called hypertension. If you have a high blood pressure, the force of the blood pushing against the artery, which is the nerve or the blood vein walls, is consistently too high. The heart has to work harder to pump blood. Blood pressure is measured in millimeters of mercury, which is the double mmHg. In general, hypertension is a blood pressure reading of 130/80 millimeters of mercury or higher. The American College of Cardiology and the American Heart Association divide blood pressure into 4 general categories. Ideal blood pressure is categorized as normal. Normal blood pressure. Blood pressure is 120/80 millimeters of mercury, which is a double mmHg or lower. So elevated blood pressure, the top number ranges from 120 to 129 millimeters of mercury, and the bottom number is below, not above 80 millimeters of mercury, is known as elevated blood pressure. We also have stage 1, which is hypertension. The top number ranges from 130 to 139 millimeters of mercury, or the bottom number is between 80 and 89 millimeters of mercury, which is the double mmHg. The stage 2 hypertension, the top number is 140 millimeters of mercury or higher, or the bottom number is 90 millimeters of mercury or higher. Blood pressure higher than 180/120 millimeters of mercury is considered a hypertensive emergency or crisis. Seek emergency medical help for anyone with these blood pressure numbers. Take note of this. Blood pressure that is higher than 180/120 millimeters of mercury is considered a hypertensive emergency risk. So it is advisable you seek emergency or medical help for anyone with this blood pressure number. Take note, 180/120 millimeters of mercury. Untreated high blood pressure increase the risk of heart attacks, stroke, and other serious health problems. It's important to have your blood pressure checked at least every 2 years, starting at age 18. Some people need more frequent checks, so it is advisable for us to always check our blood pressure at least every 2 years from age 18. Healthy lifestyle habits such as not smoking, exercising, and eating well can help prevent and treat high blood pressure. Some people need medicine to treat high blood pressure. Most people with high blood pressure have no symptoms. Even if blood pressure readings reach dangerously high levels, you can have blood pressure for years without any symptoms. You see, that is why it is good and advised for us to always check our blood pressure. A few people with high blood pressure may have headaches, shortness of breath, and nosebleed. However, these symptoms are not specific. Take note, please. They usually don't occur until high blood pressure has reached a severe or life-threatening stage. You need to see a doctor. Blood pressure screening is an important part of general health care. How often you should get your blood pressure checks depends on your age and overall health. Ask your provider, which is your healthcare professional, for a blood pressure reading at least every 2 years, starting at age 18. If you are age 40 or older, or you are 18 to 39, with a high risk of high blood pressure, ask for a blood pressure check every year. Your healthcare provider will likely recommend more frequent readings if you have high blood pressure or other risk factors for heart disease. Children at age 3 and older may have blood pressure measured as a part of their yearly checkup. If you don't regularly see a primary care provider, you may be able to get a free blood pressure screening at a health resource fair or other locations in your community. Free blood pressure machines are also available in some stores and pharmacies. The accuracy of these machines depends on several things, such as correct cuff size and proper use of the machines. Ask your healthcare provider for advice on using public pressure machines. What are the causes of high blood pressure? These are some of the causes of high blood pressure. Blood pressure is determined by two things. We have the amount of blood the heart pumps, and we also have how hard it is for the blood to move through the arteries. The more blood the heart pumps and the narrower the arteries, the higher the blood pressure. There are two main types of high blood pressure. We have the primary hypertension, also called essential hypertension for most adults. There is no identifiable cause of high blood pressure. This type of high blood pressure is called primary hypertension or essential hypertension. It tends to develop gradually over many years. Blood build up in the arteries increases the risk of high blood pressure. We have secondary hypertension. This type of high blood pressure is caused by an underlying condition. It tends to appear suddenly and cause higher blood pressure than those primary hypertension. So conditions and medicine that can lead to secondary high blood pressure include, we have adrenal gland tumors, blood vessels problems present at birth, also called congenital heart defect, coughs and cold medicines, some pain relievers, birth control pills, and other prescription drugs. We also have illegal drugs such as cocaine, kidney disease, obstructive sleep apnea, because some of us now, we can't sleep until we take pill. So most of all this can cause secondary high blood pressure. Sometimes just getting a heart checkup cause blood pressure to increase. This is called white coat hypertension. Medications and supplements that can raise your blood pressure. Anxiety. High blood pressure has many risk factors including age. The risk of high blood pressure increases with age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressures after age 65. We also have race. High blood pressure is particularly common among black people. It develops at an earlier age in black people than it does in white people. Family history. You are more likely to develop high blood pressure if you have a parent or sibling with the condition. Another risk factors of high blood pressure is obesity or being overweight. Excess weight can cause changes in the blood vessels, the kidneys and other parts of the body. These changes often increase blood pressure. Being overweight or having obesity also raises the risk of eye disease and its risk factors, such as cholesterol. Tobacco use or vaping, which is smoking, chewing tobacco or vaping immediately, raises blood pressure for a short while. Tobacco smoking injures blood vessels walls and speeds up the process of hardening of the arteries. If you smoke, ask your care provider for strategies to help you quit. A lot of salt, also called sodium, in the body can cause the body to retain fluid. This increases blood pressures. Low potassium levels is also one of the risk factors of blood pressure. Potassium helps balance the amount of salt in the body cells. A proper balance of potassium is important for good heart health. Low potassium levels may be due to lack of potassium in the diet or certain health conditions, including dehydration. Alcohol use has been linked with increased blood pressure, particularly in men. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco, or drinking alcohol can lead to further increase in blood pressure. Certain chronic conditions is also another risk factors of hypertension. Kidney diseases, diabetes, and sleep apnea are some of the conditions that can lead to high blood pressure. Pregnancy is also another risk factors of high blood pressure. High blood pressure is most common in adults, but kids can have high blood pressure too. High blood pressure is due to lifestyle habits such as unhealthy diet and lack of exercise. Complications of hypertension. What are these complications? The excessive pressure on the artery walls caused by high blood pressure can damage blood vessels and body organs. The higher the high blood pressure and the longer it goes uncontrolled, the greater damage. Uncontrolled high blood pressure can lead to complications including heart attack or stroke, heart failure. When you have high blood pressure, the heart has to work harder to pump blood. The strain causes the walls of the heart pumping chamber to thicken. This condition is called left ventricular hypertrophy. Kidney problems as complications of BP. High blood pressure can cause the blood vessels in the kidneys to become narrow or weak. This can lead to kidney damage. We also have eye problems. Increased blood pressures can cause thick, narrowed, or torn blood vessels in the eyes. This can result in vision loss. We have metabolic syndrome. This syndrome is a group of disorder of the body's metabolism. It involves the irregular breakdown of sugar, also called the glucose. The syndrome includes increased waist size, height. Metabolic syndrome. This syndrome is a group of disorder of the body's metabolism. It involves the irregular breakdown of cholesterol, high blood pressure, and high blood sugar levels. These conditions make you more likely to develop diabetes, heart disease, and stroke. Changes with memory or understanding. Uncontrolled high blood pressure may affect the ability for you to think, the ability for you to remember things, and to learn. So it is advisable you always check your blood pressure once in a year or twice in 1 year. This brings us to the end of today's edition of this program. Don't forget to like our videos and don't forget to subscribe to our YouTube channel. In case you have any comments, don't forget to drop it on the comment section below. I remain your favorite presenter, Okorie Goodness Amarachi. Thanks for watching. Bye.